Hi, my name is Dr. Wellens, and today I'm going to discuss a topic of plantar fasciitis and what's new and exciting in the world of plantar fasciitis. Well, if you're watching this video, you probably have had heel pain, or one of your friends or relatives had heel pain, and you're basically wanting to know what's new and exciting in the world of calcaneal spurs and plantar fasciitis. Well, I've been in practice for 19 years, and I've been seeing patients with plantar fasciitis for a very long time, and I can tell you is that it can be an extremely painful condition that just does not go away with regular injections, stretching, night splints, anti-inflammatory medications, and physical therapy. We always recommend that patients try orthotics, but as you probably know, some insurances are very difficult about covering custom orthotics. So for the longest time, actually for the first 15 years of my practice, the only other option was to do an open surgery. And basically, it's not that open surgery did not work. It was just basically a surgery that had some issues associated with it. Well, every surgery has possible complications, and every time we make an incision, there's always an option of, neurovascular bundle damage. There's always a situation with potential blood loss, infections. And if you've ever signed a surgical consent for any surgical procedure, you know how anything can pretty much happen, and there are absolutely no guarantees. And the biggest problem with plantar fasciitis surgery that we had in the past is that we basically cut part of the tendon that was supporting the arch. So, of course, as you probably know, if you cut a tendon that supports the arch, there are some biomechanical implications that can potentially happen, and one of them was about 30% of all patients who had endoscopic plantar fasciotomy would report some lateral column pain, which basically means people would get arthritis because their tendon supporting the arch was gone. So thankfully, about 3 years ago, Mayo Clinic came up with a new procedure called Tenex Procedure, and it's spelled T-E-N-E-X. And basically, they introduced a new technique where there is still a small stab incision that is made on the medial side of the heel. It has to be done at the surgery center, but basically, instead of severing the tendon or cutting the tendon, basically I go in and I remove the inflammation utilizing that special Tenex microscopic ultrasonic debrider. It is very effective in the situations of plantar fasciitis. The success rate in the medical literature is quoted anywhere from 90 to 95%. And there are definitely large advantages to this procedure because not only that it's minimally invasive and we preserve the anatomical alignment of the foot, but also there's no stitches. You only have to wear a walking boot for about 7 to 10 days. I always require physical therapy after this procedure, and Mayo Clinic actually recommends that we order physical therapy for it. But the biggest advantage is that we preserve the anatomical alignment of the foot. So we do not sever the tendon, we do not cut plantar fascia. So again, this was my attraction towards utilizing Tenex Procedure in my practice. And I can tell you is that with Google and all the internet resources, I'm not surprised that people come from 2-3 hours away to have this procedure done, because if you look at the reviews of the old endoscopic plantar fasciotomy surgery, the results were unpredictable. And unfortunately, some people got better, but there was a very small percentage of people that got worse. And you can only imagine how, as a surgeon, I would have to sit down with the patients who had worse results and have to explain to them why their surgery did not work. Well, with Tenex Procedure, fortunately, I do not have those very difficult conversations because the procedure never makes it worse. It either works or it doesn't. Well, what happens to the 5-10% of people who do not get better with Tenex? Well, then I give them an option of giving it more time, having more physical therapy, more steroid injections. Of course, we always rule out conditions like tarsal tunnel, complex regional pain syndrome, lower back issues, because sometimes they can manifest themselves as chronic heel pain. But basically, the 5% that do not get better then can go and have the endoscopic plantar fasciotomy done. And I can tell you is that I've had a couple of patients that I had to convert and do the open procedure. And of course, as a physician, it's very interesting for me to ask them what they thought about trying the Tenex before the open procedure. And all of them said the same thing, that they're happy that they have tried it and they're sorry that it didn't work, but it didn't make their pain worse. And at least now that I have to go in and cut their plantar fascia, they've tried everything else and it did not work and they had to do it. So of course, I am a big believer. I have great respect towards Mayo Clinic, and I have attended multiple seminars and lectures, and other physicians from all over the country had very positive response to the Tenex plantar fascia treatment, and I definitely stand by it, and I'm going to continue doing it unless there's something new and better that comes out along. So if you have chronic heel pain that is not responding to anything non-surgical, do your research. Do not settle for less. Medical information doubles every year, and it is very important to understand that physicians have to keep up with the new technology, new surgical procedures. And as a consumer, it's very important to educate yourself and know all your options before settling for less. Thank you.